Welcome to the 2014 ADAO Asbestos Conference. We're going to be marking our 10th anniversary and pause for a moment as we look back.
The conference every year is almost like a capsule of what's been going on the previous year, and I always look at them as these different little bookmarks.
So I went to DC, and Emily goes, "Mom, I want to go with you." I said, "Okay." She goes, "I want to tell my senators how hard it is for me. I'm just 11. And finally, this very compassionate attorney came out representing the senator. He goes, "Can I just tell you a secret? You need to represent more people than just your husband." I said, "Well, I could start right now, because through this whole trip, I probably have 10 other people that I could speak for right now." He goes, "That's what you need." We went to this hearing, and I met Doug Larkin.
Part of the reason why Linda and I co-founded the Asbestos Disease Awareness Organization was because we saw that there was a need for a resource that was independent of influence, that was simply science and medically based facts. And the mission that we started with holds true today.
Their ultimate goal, they told me, was very simple: to provide a network of support for patients and families, and to work towards total abolishment of the use of asbestos.
Linda pigeonholed me as we were standing at a meeting in...
Gently recruited.
Well, not so gently recruited, but gently recruited.
For more than 2 years, ADAO has led the successful effort to unite the voices of thousands of asbestos victims. Your work has brought to light the need for asbestos awareness, education, prevention, and ultimately a cure. And it has even won some big battles right here in Washington. Just last month, when the Senate debated the so-called FAIR Act, which was anything but fair, you made a profound difference. When I went to the floor to oppose this bill, I quoted a letter that I'd received from one of you.
To tell people that asbestos is still out there. It's not been banned in the United States.
Hello, I'm Senator Patty Murray, and I am so proud to receive the Tribute of Hope Award from the Asbestos Disease Awareness Organization. It's a true honor to be presented with an award from a group comprised of selfless volunteers, and I thank you all for giving your time so that asbestos victims are given a voice.
The people in this room at this time, to my mind, represent the most important people in the world of asbestos.
WHO indicates that they see asbestos as the most important occupational carcinogen. Half of the deaths from occupational cancer are caused by asbestos.
The problem is, if the workers at the heart of the U.S. government are being put at risk, you know, then imagine what it is like for the millions of unseen workers out in private industry.
I think Canada's involvement in promoting asbestos internationally is nothing short of monstrous.
Union leaders from the Michigan area are here, and I've been talking to them, and I'm so glad they're here. Thoroughly impressed to be around these doctors and these advocates and everything, and it's just so important. The Asbestos Workers Union, you know, we tip our hard hats to all of you.
In a country where millions of people live below the poverty line and desperate to get a job to survive, hardly bother about diseases that may suffer after 15 to 20 years after exposure.
ADAO's test results and the Planet Toys fingerprint kit in particular drew the subcommittee's attention and greatly strengthened the position of advocates of a complete ban.
I'm trying to think if there is another industry that has been as disgraceful and as dishonest and as thieving as the asbestos industry. It's the tobacco industry. I share everyone's concern and anger and pain in working with these companies that have put their profit above people's well-being.
Have your goals, and don't sit around and think, you know, I can't do this because I've got mesothelioma or I have cancer or whatever is wrong with you. You've got to make your plans and keep on going, because you can't just keep living with the thoughts of cancer all the time. This is just drive you nuts.
Besides the fact that asbestos causes lung cancer, mesothelioma, asbestosis, we now know and confirmed at this meeting that it also causes laryngeal cancer as well as ovarian cancer.
60,000 workers dying every year, and 10,000 of those are from asbestos-related diseases.
ADAO is filled with heroes for telling the world what it needs to know about asbestos.
Because we know what is asbestos and we know very well what it's doing to our people. Our duty is to come together as you are coming together here. Everybody raising the concern, and those concerns we'll have to take to the government.
Well, I've worked with this organization. ADAO has really made a difference. In the middle of the debate on asbestos reform, as they called it, asbestos litigation, this organization stepped up with real-life stories. And I'll never forget those meetings, sitting down with families and survivors and people who were telling me what happened when out of nowhere they learned that someone in their family had asbestosis or mesothelioma. I remember those stories when I went in to make my speeches and made my amendments and cast my votes.
Now, OSHA's been active in in asbestos control for many, many years, almost since the beginning of the agency. We've addressed several times and improved on our permissible exposure limits and our OSHA standards. There will still be much more disease out there than there really needs to be. Even what we enforce is not really adequate to fully protect workers.
One of the ways that asbestos-related diseases and radon cancers and arsenic cancers get missed is because doctors don't know how to diagnose them. So we've started an incentive program with the ATSDR and with Blue Cross Blue Shield that allows us to pay doctors actually $500 for taking 4 one-hour courses online on how to diagnose the most common causes of environmental lung cancer.
I want to thank the Asbestos Disease Awareness Organization's Linda Reinstein and honor her late husband, Alan. And I also like to thank co-founder Doug Larkin for his hard work. We can build upon their noble sacrifices by raising awareness in the hopes that no one else must die from this silent killer.
Senate resolution, shout out to the Card Clinic. We have been working with members of Congress now for 7 years. These are the facts that we can go back to, that we can power Congress to work towards a ban.
From the age of 10, I always asked, why is an asbestos banned? It just seemed so simple to me. It just didn't seem like a big deal. I mean, I understand that there's a factor with the businesses and everything, but if people are dying, it just doesn't seem like something that should be legal.
I think a lot of people don't understand that there is currently not a ban, which is part of the problem.
And if you think people are more important than money, then join together and let us create the atmosphere that allows us to have the political will to ban asbestos and make this a safe, healthy world for our children and our grandchildren.
We still have a long way to go in this fight against asbestos, but I'm confident that by working with the Asbestos Disease Awareness Organization and other activists, we can win the war against asbestos and help protect our families and communities from asbestos.
The World Health Organization, the ILO, the U.S. Surgeon General, the list goes on, American Public Health Association. There is total consensus. Asbestos is a known carcinogen, and there's no safe level of exposure.
A gynecologist in charge of treating asbestos miners says there are no sick people in the asbestos mine. Of course, he is looking in the wrong place.
That it's the same story everywhere. Big companies deliberately exposing their workers and the public to a product that they know can kill.
Mesothelioma is a miserable disease.
Fix it. Fix it. Everything in the world can be fixed.
And I must recognize Linda and Doug for your work in this arena. In the 9 years since you founded the Asbestos Disease Awareness Organization, your efforts and dedication have been unmatched. We need people like you to hold us lawmakers accountable and to ensure policymakers take the necessary steps to prevent all asbestos exposure everywhere.
We buried a dear friend, Larry Davis, in July. He couldn't accept his award last year at our conference. He was too sick. He lost his courageous fight. But all of us here today
can help Larry and the other Larrys by sharing what you learned today?
The breath beneath your wings, and that's for the sufferers and their family.
A big European-based asbestos cement company were convicted in a criminal court and sentenced to 16 years apiece in jail.
I'm proud to say my mom has mastered the art of speaking with representatives and has come a long way since our first time here on Capitol Hill.
It's so important for victims and concerned citizens to tell the story of those that have been affected by asbestos. And with over 20,000 people in your organization's network, you're a loud and important voice for regulation of this dangerous chemical.
What a great anniversary present. We get to have the acting U.S. Surgeon General, Boris Lushniak, deliver our keynote address. By the Surgeon General's office accepting that invitation, it validates ADAO and the purpose behind our work.
I remember at the time of Bruce's diagnosis, we knew we did not have a long time. And to this day, I'm meeting mesothelioma patients who have been living for years with mesothelioma. And that's the best part, is getting to meet folks who have lived 5, 10, 15 years with this disease.
I mean, if somebody's pulled into ADAO, then it's your life. It's surrounding you, it's a part of you, and you're there.
After 10 years, we've grown up together. We've shared losses, but we've also shared happiness. And the one part that's probably strongest for me is that we have become this force that can't be reckoned with.